Most people come to the office, for example, thinking that a bunion is a skin condition. And they think that this can be fixed in 5 minutes and it will be over. And I usually use visual aids such as foot models, computer models, and showing patient exactly that a bunion is a bony abnormality generated from biomechanical conditions. I do explain to the patients that if they want the bunion treated, that means gone away, that's a structural condition that needs to be addressed surgically. However, there's non-surgical alternatives to treatment, such as orthotics that we handle in the Everett Clinic, wider shoes, shoe modification, or all that. Surgical treatments usually involves realigning the bone through multiple surgeries, and everyone is different. This is where we sit down with the patient, we go over the x-rays, and I explain to the patient that what to expect. Patients that come to my office, they believe that once they have a bunion surgery, they'll have to be on a cast and off of their work or something for 3 months or so. That's not always the case. Sometimes that applies to some patients, but 75% of the patients will be able to walk on it right away. And usually pain is well managed by oral medications. A lot of my patients choose not to take narcotics during this surgery, during the postoperative period. Issues that bunions cause for patients are usually related to discomfort and pain. However, the big misunderstanding about bunions, and I see this when patients come to the office and they tell me that, well, a family or a friend or a doctor told me not to do anything about it until it's painful. However, that's a misunderstanding. Bunions don't have to be hurting to cause problems. Bunions can cause misalignment of the foot, can lead to secondary conditions such as hammer toes, can lead to arch pain, and more foot deformities, gait problems, and also deforming and subluxing and dislocating the toes next to the big toe as the toe deviates forward. There are many patients that come to the office that they have waited for the bunion to hurt, and they have passed that stage of the bunion when the joint has already deteriorated. And as a part of education, we tell patients that, if you had come in earlier, we would be able to salvage this joint. But once you wait for a bunion to get to the point that starts hurting, you are waiting for the joint to become from a salvageable position to go to a non-salvageable position, as a bunion is a misaligned joint, and every misaligned joint will eventually become an arthritic joint. Why wait for a condition that is not treatable, such as arthritis, where you can prevent it by realigning the bone in the correct position and preventing a not treatable condition?